Well, it's Thursday, and of course, as we always know, Linord Moudou of InFocus's health segment joins us today. What do you have?
Today we are looking at fistula, which is a condition that is caused by prolonged labor before birth. And we go to Côte d'Ivoire, where some doctors have made patients very happy. Some fistula patients are getting surgery to cure their condition and celebrating their new lives in dance. Correspondent Khalil Gay explains.
This dance symbolizes the end of a long ordeal for 35 women who suffered the pain and humiliation of fistula. After they are done singing and dancing, they pass through a door and return to a normal life. As a final stage of this fistula treatment program, they participate in a fashion show. The ceremony is a ritual set up by Dr. Kwame Bile at the hospital of Mons in the Ivory Coast. He's treated hundreds of women and is helping to lead the fight against fistula in West Africa.
You see, when they have fistula, they cannot participate in public events. They cannot join dance parties at the village. As soon as they come out, urine flows and the odor makes people move away from them. They are excluded from everything that brings social cohesion. Now that they are cured, they dance because now they can go out in the public.
Nadège Gueye came to the hospital from her village of Zouan-Huignan. Like many women with fistula, she suffered alone, shunned even by family and friends.
When my fistula appeared, everybody in the village rejected me. My husband disappeared, and even my parents did not want to help me. I suffered for 7 years. When I finally was brought here in Mons by my uncle for treatment, I saw several women undergo successful operations and leave totally cured. I am being treated here, and I'm sure I will be cured too.
The United Nations Population Fund leads the global fight against fistula. It co-sponsored a study that says the condition affects about 100,000 women a year in sub-Saharan Africa. Yahya Khan helps to coordinate the fund's campaign to end fistula.
Our strategy is multi-sectoral, integrated. It goes from the institutional upgrading and equipment of facilities, training of professionals, and most importantly also, we try to work with the communities to make sure that we trigger positive social transformation, attitudinal transformation, and behavioral change to make sure that families, the communities, the gatekeepers, and all leaders, be they traditional, professional leaders, or even faith-based leaders, are successfully sensitized on the issue of fistula and maternal mortality.
Nadège Gueye is happy and eager to go back to her community. Her doctors say she is cured.
Ta main mouillée? Non. Ta main mouillée? Non. Donc elle est guérie vraiment? Elle est guérie? On va applaudir pour elle.
And she is thankful. But she says she will miss the joyful and dancing Dr. Bile. Khalil Gay, VOA News, Mons, the Ivory Coast.
And fistula is indeed a condition that is spread in sub-Saharan Africa. We move now to Ethiopia, and in a documentary entitled A Walk to Beautiful, Angel Entertainment, who produced the documentary, looks at the debilitating condition and how a hospital in Addis Ababa is bringing hope to fistula patients. Here is an excerpt.
I used to live in the countryside where 5- and 10-year-old girls are given in marriage. I got pregnant when I was 13. I was in labor for 3 days, and then my father agreed to take me to the local hospital. But we never reached there since the baby died in my womb. I had to deliver the stillborn child on the road. After a few days, I noticed the leaking, but I thought I would get well once the baby was out. I leak urine constantly while sitting and sleeping. I feel insecure seeing my friends work while I could not. I decided to leave my village to stop comparing myself to them. I love my father dearly, but I left him because of my condition. I miss him a lot. It has been a long time. When I was living at my home in the countryside, I heard people talking about a treatment. I heard there's a place in Addis Ababa. I'd rather have my arm cut off than have this problem. At least I could mix with people. Nothing worse can happen. I'm not sure if I can be cured.
Let's ask you a quick question. Well, what a powerful documentary, at least the little bit that we saw. Linord, what can you tell us about this fistula and really how widespread is it throughout Africa?
Well, it's a condition that is very much widespread, but the fact that it doesn't have much attention as, let's say, something like HIV/AIDS or malaria, people do not realize that it's really, really part of many cultures in Africa and around the world also. Because one of the reasons of this condition is the fact that women are being married or bear children at a very young age. Some women have children at 10, 11, 12 because of, sometimes cultural reason they get married. And that's one of the reasons in Ethiopia. We saw the documentary which talks about the lady, this young woman in Ethiopia. That was her case. And she was very young and she had a pregnancy and she could not hold that pregnancy. So she ended up...
Is there a cure? What is being done to address this problem?
Well, the way this problem is addressed is with a surgery. It seems to be according to expert, it's a very simple surgery and not very costly. But of course, when you look at the context where the surgery has to be done, sometimes it appears expensive. And this documentary we saw actually was produced and looking at this hospital in Ethiopia, in Addis Ababa, was the Hamlin Fistula Foundation. And they have been doing this, providing surgery since 1974, helping women there because some of the women get married very, very young again. And they've been doing this. They have helped more than 35,000 women with this surgery.
Now, why is it that most of the women are shunned after they develop this condition?
Because, as the young girl explained in the documentary, they have fishes and urine that are leaking all the time, and they don't smell very good. And also, people are always fear of what they don't know. That you see a woman who is just leaking constantly urine and fishes, and you wonder what is happening. Is she cursed? Did she do something bad? So when you don't know something, you tend to fear it. And of course, it is true for so many different conditions. Even HIV, you have stigma. So it's all about the issue of stigma once again.
Well, thank you.
We really hope that this condition, at least the people that are working in this field, hope to have more awareness about this.
Well, thank you so much. I think we shed quite a lot of light on that condition, and hopefully there's a remedy.
Absolutely. Thank you.
Okay. Now, for more information on these stories, please go to voanews.com. Again, we thank you, Linord Moudou, for joining us, and she joins us every Tuesday and Thursday with the latest in health news.